Hi, my name is Pamela, and I was referred to Dr. Parker in October because I had a mass on my head that wasn't healing well. So he went through a process of teaching me, and the nurses taught me how to kind of pack that wound so it would heal from the bottom up. And then I had another surgery to remove the rest of that mass. And then we did a procedure of packing it as well, and the nurses taught me how to do that again. And it's a long process, and it's a tedious process, but it's the right process to do, because through that process and all the pathology and all the checks that Dr. Parker and the team did along the way, there was a mass that started to grow to the side of where I had had the original mass removed that had nothing to do with the first mass. And it grew, and a pathology came back that was questionable for cancer, and they followed the protocols and sent all the pathologies to a pathologist in the city, in New York City, to review everything. And during that time, as we were waiting for the results, this extra mass on my head started to grow, and started to grow rapidly. And when I came in to see Dr. Parker after it had started to grow, it did confirm the pathology, and it was called keratoconthoma, which looks and acts like cancer, and mine was cancer. And Dr. Parker referred me to a Mohs surgeon to remove the mass, so that the Mohs procedure, you're awake for it, and as they're removing their mass, they're constantly doing the pathology so that they get all of the cancer as deep and as far as they can go. What was very terrific was during that whole Mohs procedure, the Mohs surgeon was constantly in contact with Dr. Parker to let him know, because after the Mohs procedure, the following day, Dr. Parker's was to close the wound in the mass. And it turned out to be much more extensive than we originally thought. So I wound up with about a 2-inch diameter of a hole in my head, on my scalp. And they actually had to go down to the bone, and to be extra, because they did find cancer, down to the bone, and the Mohs pathologist did remove it to that level. But as an additional precaution, the recommendation was to what they call burr the bone. And that's one of the things that Dr. Parker did. So after the Mohs procedure, I came here for Dr. Parker to kind of look at it and start to come up with a plan for the next day to close the wound. But I was wrapped quite a bit, so it was kind of hard to look at the wound to heal it. But the Mohs surgeon had taken a lot of pictures and sent them over, so he wasn't able to have a plan for the next day. And the next day I came in, and they closed the wound, and a lot of sutures, a lot of stitches, a lot of cutting, a lot of bandages. I had a drain and a tube, and but actually, as frightening as it was, the whole process, it wasn't as frightening, because the doctors and the nurses gave me a lot of comfort and just kind of kept talking to me and helping me understand what was happening, why it was happening, what to expect. And the next day when I went home, the nurses called me to make sure that I was okay. Thought of little things that I hadn't thought of. You know, I didn't think I wouldn't be able to move my jaw to eat or anything like that after the procedure. So the thought of drinking Ensure doesn't register with me, but they were like, drink Ensure, you have to get up and walk around. It's important for your circulation. So all those little things that you don't necessarily think about is going to be part of it. The next day they called to help me with a solution. And so that surgery was in January, and I've been coming here every 2 days and then every week afterwards, and I feel it's healing. It's a slow healing process, so patience is really important. And Dr. Parker and the nurses helped me remember patience. And I would say that's the most important thing, is to have patience, ask questions. You really almost don't have to ask a lot of questions, because Dr. Parker and the nurses cover so many different aspects of it. But as hard as it's been, I wouldn't want to have done this anyplace else. So